Assume that manufacturers need to prove their products are safe and effective. But that's not necessarily the case. Critics say what's missing is solid scientific evidence that complementary medicines actually work. The ABC's medical reporter Sophie Scott reports.
I had a bit of extra weight on me. I thought it'd help me trim down more. Like it just helped with my training.
Jack Burke is a fit and healthy 21-year-old. He doesn't look like a candidate for weight loss pills, but he wanted to tone up for footy season. Some of his teammates had tried some, and after he saw a TV ad, he decided to give them a go.
The best reward was losing 28 kilos thanks to Fat Blaster.
There was a young bloke and a young woman who looked $1 million, didn't have an ounce of fat on them, and I guess that's sort of what they can do it. I mean, I can surely do it.
He spent $50 and took the pills for 2 weeks.
They weren't really doing much except for making me feel sick, and it sort of affected my training because I had no energy and I couldn't keep any food down, so it was a big waste of money.
The manufacturer of Fat Blaster said it would rather not comment on Jack Burke's experience. Like many other weight loss products, Fat Blaster is a complementary medicine sold over the counter without a prescription in chemists and health food shops. Complementary medicines cover a range of products from vitamins, minerals to nutritional supplements and herbal medicines. Many of them make health claims, often using scientific jargon or promises of natural ingredients to attract customers. That concerns one of the country's leading health experts, Dr. Ken Harvey.
The complementary medicine industry now is almost a $2 billion industry. To me, it's just absurd that Australians are spending this amount of money on medicines, and we don't know whether they work, whether they don't work, and they haven't got the information to find out. That's crazy stuff.
Companies are required to hold evidence that their products work, but in 3/4 of cases it's never checked. That's not the case for pharmaceutical medicines. Manufacturers have to provide compelling evidence that their products are not only safe but effective as well.
Every sponsor of a product must hold evidence that their product works prior to it being released on the market. So even though only 25% of products are checked by the Therapeutic Goods Administration, 100% of the products do have the evidence behind them.
Hey, sweetheart. Can you make me a cup of tea, Dal? Thanks.
Yeah, all right.
So I'm taking a multivitamin. I'm taking some stuff called, it's a green yucky looking substance and also a green sort of mineral drink as well.
Even those who swear by vitamins and supplements want to see greater regulation of claims made by manufacturers.
Oh, that's good.
Cynthia Murphy is in remission from breast cancer. She credits her return to good health to the cocktail of supplements she's been taking since her treatment finished.
Gives me a lot more energy and just allows me to concentrate more when I'm at work.
But even she believes supplements should be tested to make sure they work.
There's a lot of other unscrupulous people out there that are pushing, various bits and pieces in relation to cancer. This is a great, cancer-beating drug, but none of it's been tested. And there's a lot of people out there who are clutching at straws.
The Therapeutic Goods Administration is the body charged with regulating the industry. Critics question the level of evidence accepted by the TGA and the amount of checking done on the veracity of claims made by manufacturers.
It is possible for you to put your hand on your heart and say that this product has been traditionally used in an isolated community, for example, a third world community, and that's allowable if that's all you say.
That's a suggestion rejected by the Complementary Healthcare Council.
All products that are marketed as medicines, all herbal medicines, vitamins and minerals, things like red clover and glucosamine, all of those types of products are very heavily evaluated for safety and quality.
The consumer walking into a chemist shop or a health food store hasn't got a hope of actually knowing what works and what doesn't work, just looking at what's on the shelves. And do you take any supplements like calcium or vitamin D?
Associate Professor John Eden is the head of the Sydney Menopause Centre and runs clinical trials of medicines for complementary healthcare companies.
The good news is that this particular product is safe.
He'd like to see a system where medicines that have gone through proper clinical testing can be distinguished from others.
Are they good? Are they high quality? Are they safe? Do they work? And if something does meet those criteria, it then gets a green tick. And the company that makes the product would pay for the privilege and be able to advertise the fact that their product is actually clinically tested.
The consumer group Choice is one of the groups pushing for tougher regulations.
We know from some surveys that people say they would use more complementary medicines if they could be sure that they worked. So we think there's a need to get that information to consumers so they can make an informed choice.
Wendy Morrow from the Complementary Healthcare Council maintains that the Australian regulatory system is one of the most rigorous in the world and rejects the need for radical changes.
Sounds like a good idea, but in the end it would be another level of regulation, and the costs of maintaining that level of regulation would ultimately be borne by consumers.
The Federal Health Department has just completed a review of complementary medicines. Among the measures being considered are new mandatory standards of quality and an overhaul of the requirements regarding evidence.
You go into a pharmacy, go into a health food shop, you've got no idea, for example, which brand of glucosamine works, which brand of ginkgo biloba has had controlled trials. That information just isn't available in Australia, and we think it should be.
Sophie Scott with that report.